I think this event comes at a critical time when it's really needed. We spent over a year with this pandemic and this challenge. I think we have a lot of learnings from different entities that we should share, discuss and build upon. This is why I think it's very important for such an event to be organized at this time.
I think it was a really thoughtful discussion. The 2 or 3 key points that I've taken about it is the importance of data, the importance of using that data properly.
This has been one of these events where you actually get value out of it. It's been very interesting to hearing where we are in the UAE, what the ministries are thinking.
It was a great session, great discussion. Everything got covered and we all really found out that we're all on the same sort of page. We all recognize the same issue.
Probably learned from the last 15 months is how things have to change, and we have to move forward very fast with understanding how to use new technologies.
Complement each other in terms of skills rather than compete with each other, so collaboration is definitely the key.
Old healthcare model is outdated, and I think that now either we work on the public sector or on the private, we have to embrace this new way of collaboration on how healthcare will be delivered.
The collaboration of data and sharing that data with other entities, whether they be agencies, hospitals, private sectors, because that's the only way we can understand more about who we are and what we can do.
We should not start with problems and find technologies to solve them. I think we should reimagine our life around these new technologies. So reimagine ourselves, reimagine our institutions, and reimagine our customers and society around these. If we don't do that, we always fall behind.
And from my perspective, the hospital as we know it is no longer the answer. And the care should shift from this central hub that the hospital is to something that is more relevant to the patient. So all the health system needs to revolve around the patient, and the patient becomes at the center of everything we do.
I would say we have an opportunity to reimagine the future of healthcare. Let's capitalize on it. Let's bring everything that we've learned in COVID in one place and let's implement what we've learned. Digital, data, virtual care, AI, people like the technology and the gadgets. The art is there, it's proven, let's capitalize on it.
My number one advice at this time is taking advantage of this opportunity to accelerate our agenda going forward, whether it was accelerating the technological infrastructure and adaptation or accelerating other ways of doing healthcare, whether it was a value-based healthcare system or a human-centric healthcare system that we can build upon into our future to be more agile and adaptable going forward.